Hello, everybody. This is Gary. Today is Wednesday, September 28th, 2022. It is 4:04 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today, my psychiatric symptoms are not that bad. I did go outside today and run some errands, and I met with my primary care provider. My paranoia was not that bad on the bus or outside. My auditory hallucinations are at a minimum. Um, my depression is not that severe. My anxiety levels are pretty average. My paranoia and delusions are not that severe. Um, so I'm doing pretty good. As far as my physical health, everything seems to be going okay. There's nothing that me or my primary care provider identified as being a severe problem. I did bring up the issue of my blood pressure. Um, my primary care didn't see a reason to add or increase my blood pressure medications. My blood pressure was like 135 over 80, so it wasn't that high. Um, I do have my own blood pressure cuff, and I was told by my cardiologist if I measured my own blood pressure at a consistently high rate, that they should increase my blood pressure medication or add a blood pressure medication. But we didn't do that today based on the blood pressure reading I got at my primary care doctor's office. And nothing else has really changed. All the meds are the same. I'm still taking Cymbalta for physical pain, Neurontin for physical pain, Flexeril for back pain, Motrin and Tylenol for physical pain. So nothing has really changed in that regard. Um, I have a feeling that if I try to go off any of those medications, my severe pain throughout my body would return. Also, I had a weird pain sensation traveling all over my skin last year, like my skin was on fire, and I started taking the Cymbalta and that pain went away. It was a very weird and unusual feeling. So the Cymbalta has helped with that, and also the joint pain and the knee pain and the muscle pain. So is the Flexeril and the Neurontin. Um, the nerve pain is under better control. I'm assuming it was nerve pain that made it feel like my skin was on fire. Like somebody literally was pouring gasoline over my skin and setting it on fire. Um, but all that's been under control for months now. I've been on Cymbalta now for quite some time, as well as the Neurontin and the Flexeril, and the Motrin and the Tylenol also do their part. So we didn't change any of my medications today, and my primary care provider. And tomorrow I am seeing my peer support specialist. She's one of the counselors that works at my mental health clinic. She is someone who has a mental health diagnosis of obsessive compulsive disorder, and she is there to help me counsel me with my symptoms of schizophrenia and schizoaffective disorder. Um, I'm meeting with my therapist, I believe, on the 12th of October, as we approach the end of September, and I will be seeing my psychiatrist in late October because I just saw him recently, and we did increase the amount of Klonopin. Klonopin I'm taking every day from 1 milligram to 1.5 milligrams per day, spaced throughout the day, because my anxiety levels are very high, and they always get worse just before and during winter. Winter is a hard time for a lot of people. Depression tends to get more severe, anxiety tends to get more severe, and in my case, my auditory hallucinations and my paranoia and delusions get worse during the winter. And as we approach the winter, also my arthritis pain tends to get worse in the colder weather. Um, I intend to get a space heater to keep my apartment warmer than it was last year. Electricity is included in my rent, um, and I do have heat included in my rent, but I think the heating that they use in this building is antiquated and insufficient. So I'm going to get a space heater that will help heat my apartment. I'm in a studio, so my bedroom is the same room as my living room, and I only have one basic room aside from the kitchen and the bathroom. Um, I'm just glad that I'm not homeless and mentally ill and wandering the streets babbling to myself. That's why I take my medication.